Ladies and gentlemen, very, very warm welcome to this week's Caabu seminar. I hope you're all well, bug-free, and all your friends and loved ones are well as well. And it's heartening to see how many of you have joined us today to discuss this really vital topic of the issue of coronavirus outbreak in Syria at this time. I'm grateful to you all to joining us. And we're also doing this today, Caabu, in conjunction with the LSE's conflict research program. So my thanks once again to them. And as we face our own crisis in the UK, as tough as that is, as challenging as it is, let's reflect for one moment how fortunate we have been over many decades not to have faced a crisis like this. In contrast, so tragically, Syria has seen 9 years of crises, wars, crackdowns, extremism of the most vile kind, and now faces a very serious threat of this coronavirus pandemic. As you know, so far official figures show 19 cases of coronaviruses and 2 deaths, very sadly, but we are absolutely certain this is far from the true reality of what is happening on the ground across Syria. And we have a general broader situation of the Syrian economy in freefall, the Syrian lira hitting an all-time low against the dollar. I think it's 1340 lira to the dollar today. Prices of foods, vegetables, grain hitting all-time highs, and a severe bread shortage across the country. You would have seen images of bread queues in various cities, and even hours of electricity lowered as more and more people are forced, of course, to stay inside. So we are really fortunate today to have 2 excellent Syrian speakers, academics, who've just published an excellent paper. We'll circulate that on the chat group here on the issue at LSE, Zaki Mehchy and Mazen Gharibah. I'm not going to read out the entire bio, but Mazen is a research associate at the Conflict and Civil Society Research Unit in the Department of International Development at LSE. He's part of the conflict research program working on Syria. Mazen is very well versed in this, and he's done a lot of work academically and policy work as well. Zaki Mehchy is also a research associate at LSE, working with the Syria program, and he's also a senior consulting fellow at Chatham House, co-founder of the Syrian Center for Policy Research. So Zaki is going to speak first, followed by Mazen, and then we're going to have a Q&A. And if guests have questions, I remind you, please do add them to the chat, and we'll try to get them in for you. I suspect there'll be quite a few. Just so it's clear, the meeting is on the record and being recorded, as of course we wish to shine a light on the challenges that Syrians face right now after the meeting, and to let others share in the excellent research and analysis of Zaki and Mazen. So Zaki, over to you. We look forward to your presentation.
Thank you. Thank you very much, Chris. And would like to thank Caabu for having us or giving us the opportunity to discuss this important topic on COVID-19 in Syria. And as you mentioned, the latest update, the official update, that the total number of people with coronavirus cases in Syria is now 19. 2 died and 2 recovered. And actually, this is the official number announced by the Ministry of Health, and we believe that the number is much higher. The low number is most probably due to 2 main reasons. The first one is the lack of testing capacity in Syria. And as announced yesterday by the Minister of Health, that Syria is now conducting only 100 tests per day. 50% of these tests are being conducted in Damascus, in only 1 governorate. And there are only 4 centers, health centers, that are able to conduct these types of tests. So there is a very poor testing capacity. And actually in the northeast areas, there is no capacity at all. And the conducted tests is zero so far, and the authorities there sent a request for testing to Damascus, but Damascus refused to conduct this test for the northeast areas. The second reason why the number is so low, we believe that there is also lack of transparency by the Syrian authority. Based on several interviews with medical staff from the ground in Syria, they told us that they received kind of verbal request from different security agencies not to mention or not to raise alarms about the recent surge in the number of pneumonia-related deaths. And these medical staff believe that there are many people who are dying in Syria due to that they have coronavirus symptoms. But the security agencies asked them or ordered them not to mention this, especially to the media. So we have these two reasons for the low number, but at the same time, we have many evidence that support the fact that the number is much higher in Syria, based on the ground, based on our interviews with medical staff, and based on the current conditions in Syria. Now, moving to the containment capacity for Syria in dealing with the COVID-19 pandemic. And here we have also 2 points. The first one is related to the capacity of the government in preventing the spread of the pandemic in Syria. And the second point is the treatment capacity of Syria in terms of COVID-19. Now, in terms of impose precautionary measures by Syrian government, actually the government of Syria is taking this kind of precautionary measures, including, for example, the closures of schools, restaurants, and recently the government banned the movement between governorates and between Syrian cities to prevent the spread of COVID-19. But the question here is to what extent these measures are practical, and to what extent people in Syria are able to implement these measures, especially from an economic point of view. For example, the closure of small businesses and restaurants will affect directly the already poor and vulnerable groups that they don't have access to other income resources. So this is in terms of preventing the spread of COVID-19. Now, in terms of treatment, of course, after 9 years of conflict in Syria, the health sector is almost destroyed. We only have in Syria less than 50% of public hospital functioning. We have 70%, or Syria lost 70% of its medical staff. They left the country as migrants or refugees. All this, of course, in addition to the sanctions, so Syria does not have access to, or it has difficult accessibility to renew the medical equipment and to import the appropriate medicines to the country. So all these conditions actually weaken the capacity of Syria in terms of treatment for COVID-19. The current available, for example, the current available adult ventilators in private and public hospitals in Syria is almost 325 ventilators. And here we're talking about the available, not occupied ventilators. In general, Syria has almost 650 ventilators. and this is very low. Of course, the occupancy ratio is almost 50%. So we have the available number that we have is 325. 50% of these available ventilators are in only 2 governorates out of 14 governorates. The 2 governorates are Damascus and Latakia. Of course, some governorates like Deir ez-Zor, they have 0 available ventilators. So the overall situation in Syria is very difficult. They don't have the capacity to contain or to prevent the spreading of COVID-19. But of course, some regions are suffering more than others. For instance, Deir ez-Zor, as I mentioned, that they don't have even, or they have 0 ventilator available for the potential or to treat potential COVID-19 cases. And yeah, thank you. I tried to be brief so we can open the discussion later.
Thank you very much, Zaki. That was terrific to kick things off. And now we turn to Mazen, who's going to continue the discussion.
Thank you, Chris, and thank you, Caabu, for this opportunity. I will continue from where my colleague Zaki stopped, and I'll try to speak on focus on Northwest and Northeast Syria. But before I do that, I also want to mention that in the regime-controlled areas, that's the obvious interference by the intelligent forces in the healthcare policies is also raising the level of people's fear to seek the most needed medical attention. People are reacting to COVID-19 as if it is a taboo or a security threat. For instance, 2 days ago, SANA, the official news agency, Syrian news agency, published a threatening infographic asking people to report or to inform the authorities of any suspicion of COVID-19. According to several doctors we were talking to, people are now more afraid to go to public hospitals. They're afraid that they will be questioned or harassed by the intelligent officers. Therefore, they're seeking discreet medical help and advice from private doctors if they can afford it, which clearly raises the risk of infection and spread in Syria. As for the Northwest and Northeast Syria, for years now, all of the emergency response plans are usually implemented by the understaffed, underfunded local health actors, such as the Idlib Health Directorate in Northwest or the Health Commission in Northeast, in addition to international national medical NGOs. For years now, there are severe shortages of medical supplies and trained medical workers, specifically nurses and ICU technicians and respiratory specialists. In Northwest Syria, for instance, according to the Idlib Health Directorate, there are only 600 doctors for over 3.5 million people, which means that there are around, and also there are 3,000 beds in total in all health facilities in all of Northwest Syria, which is approximately 1 bed for over 1,500 people. Out of these beds, there are only 20 equipped ICU beds, which are currently available right now for COVID-19 patients. That's it. There are almost 95 ventilators for adults in Northwest Syria, but less than 20 are fully functional and currently available to treat COVID-19 patients. There was a delay from the WHO response to areas outside of the regime control. Until recently, only last week, only 600 testing kits were delivered to Northwest Syria, and none has been delivered to Northeast Syria so far. Northwest Syria, they only have 1 PCR machine with the capacity to test less than 15 patients per day. And Northeast Syria, they don't even have a PCR machine, even though that 5 new additional PCR machines were delivered by WHO to the government 3 days ago, but none has been delivered to Northwest or Northeast Syria so far. Even with these kits, the kits that were delivered to Northwest Syria, health actors are having problems using them. According to our sources, only 29 tests have been conducted so far in Northwest Syria, and they all came negative. The main issue, when I was talking with Dr. Khalil, the head of the Dr. Mazen Gharibah, the head of the Idlib Health Directorate, in a panel 2 days ago, he said something very important. He said that the main issue is not the testing kits alone. The main issue is that you can test people, but what comes after that is the main issue. The WHO-led Turkey-based health cluster has established a task force with all relevant actors in Northwest Syria, including the Idlib Health Directorate. And this task force developed an emergency plan which consists of allocating 3 hospitals and 28 quarantine centers. But till this day, nothing has happened. This plan is still ink on paper. Nothing of that sort has been implemented so far by the WHO or by the health cluster in Northwest Syria. And of course, in Northeast Syria, they're facing the same issue here. They don't have testing kits. They don't have PCR machines. Even the emergency response plan, which was also developed by the Health Commission in Northeast Syria, was not fully implemented. Add to that, in Northeast Syria, you have also the issue of the isolation of the surrounding areas, and the exclusion of the Yarubiyya border crossing. The inclusion of that border crossing from the UN cross-border humanitarian response has immensely limited the accessibility to Northeast Syria, leaving them at the mercy of an unresponsive regime. For instance, my colleague Zaki mentioned that all the samples that were collected in Northeast Syria were sent to Damascus, but all of them were ignored. They haven't heard back, and they're not. When I talked to them yesterday, they said we're losing hope. We're not going to hear back from Damascus anytime soon. So, which lead me to the catastrophic implications of the politicization of the COVID-19 by the Syrian government, which clearly using the current pandemic for its own political gains, gambling with the lives of millions of people outside of its control. People, health actors, doctors in areas outside of the regime control are trying to contain and trying to spread awareness about this issue, but they have very limited resources to do so. The civil society organizations in these areas are doing a great job. They're doing fantastic work in spreading awareness and trying to do trying to increase the social responsibility and all of that. But they have very limited resources, and the medical kind of infrastructure is not helping them as well. And also, it seems that the WHO, knowingly or unknowingly, are playing to the regime's narrative. When an official spokesman of WHO told the New York Times on March 19 that they only deal with Damascus because it's a government, and the Northwest is not a government. For me, it shows a great deal of ignorance of the political reality of conflict in Syria, and it raises concerns on how WHO are dealing with violent conflict settings. I mean, one cannot simply assume that the regime who was systematically targeting hospitals 3 weeks ago is going to provide these same hospitals with medical equipment next week. I mean, it just doesn't make any sense. And I don't want to take a lot of time because of the discussion, but I want to raise some last issues here. That usually when we talk about risk groups globally, we use medical terms like age or pre-existing conditions, medical conditions. But in Syria, we have different additional risk and vulnerable groups. We have the detainees who are living in inhumane conditions without any medical care. We have IDPs who are mostly living in makeshift camps in Northwest and Northeast Syria. These camps which lack the basic necessities of life, like running water or electricity. And of course, women who are particularly vulnerable to conflict-related violence and who are unable to cope with the economic pressure and the social impacts of the self-isolation and quarantine during this pandemic. So these are more or less the main issues and obstacles in areas outside of the regime control, which clearly indicates that a catastrophe could be inevitable, unavoidable in such areas. And Thank you. Looking forward for the discussion.
Thank you very much, Mazen, and thanks to Zaki as well. So now it's the chance to ask questions. I think some of you may not have heard me in the beginning, so just to say that this is on the record, this meeting, and being recorded, just so that you know, so you're free to use the information. And we're getting in some questions already, but we had a couple actually emailed us to begin with. Diana Dark had a question. Diana, are you with us?
Yes, I sent it in. So it's to do with the economic impact of closing the borders. What is the best guess about how long they can sustain that economically? And would either Mazen or Zaki like to give an estimate of when the borders might be reopened?
Which one of you would like to take that question?
I mean, I can try to answer. I don't think we have an estimate on when the borders would be open, because it's not just the Syria who decided to close the borders, also the neighboring countries. But when it comes to the humanitarian response, as far as I know, most of the equipments and medical supplies to the government, for instance, are coming through Jordan, through the OCHA hub in Jordan, through the Jordanian borders. So the borders, the cross points are open for medical supplies and for humanitarian aid, and they were not closed. So, for instance, the recent PCR machines that were delivered to the government, where they came from Jordan through the Jordanian borders. As for the rest of the the borders, I don't think they will be open anytime soon for economic transactions, but they are still open. The main cross points are still open for humanitarian aid and support. For instance, the Bab Salami or Bab al Hawa with Turkey are still opening. They're still getting medical supplies from the Turkish market to the northwest, but they don't have that in northeast. In northeast, they don't have access to Turkey or to the Kurdistan region of Iraq anymore. They only have access to Damascus, which raises a lot of issues and concerns.
Yeah, I would like to elaborate more on the economic impact of closure border. I believe that there is a financial problem here for the government of Syria, and for all regions, because, for example, the closed border between Lebanon and Syria now affects directly the flow of money between the two countries, which was already affected by the banking crisis in Lebanon. So now the Syrian private sector cannot have hard currency that they used to have from Lebanon, directly from Lebanon, to import the necessary goods. And now Syria and the regime-controlled area are facing a drastic problem in providing bread for all people, because there is a problem in importing flour from Russia and Ukraine. This is the first point. The second point, also, the additional cost of the imports, even from China and India. This also put more pressure or economic pressure on the final consumers. And here we're talking about the majority of people, or the ordered citizens, taking into account that already 85% of Syrian people or Syrian population are living under poverty line. So they will have, for sure, additional economic pressure and financial pressure due to the closed borders, or the difficulties in the relations with external parties.
Thank you very much. And just on a an additional question really that follows up on that. I mean, I think that many people suspect that one of the reasons that COVID-19 spread in Syria was, of course, the continuing linkages with Iran. Is this something that you see as being really party to the spread of the virus in Syria? And is it one of the reasons perhaps the regime is sensitive to those links, air links, largely, of course, still being open?
Yes, actually, the issue of the Iranians, yeah, we mentioned this in the memo, that Iranians are in Syria in terms of the militias, the armed groups. They joined the armed groups. So we have a lot of Iranians as a part of these armed groups and as a part of military consultants for the regime. And also we have the religious tourism by the Iranians in Syria, coming to Syria. And the last estimates by the Central Bureau of Statistics in Syria, in Damascus, mentioned that Syria received yearly 22,000 Iranians as tourists who visit religious places, mainly in Damascus. And the movement of the Iranian tourists did not stop till the beginning of March. So we believe also that the flow of Iranians, or the movement, or the free movement of Iranians, militias and tourists, religious tourists, contribute to the spread of COVID-19 in Syria.
Thank you very much, Zaki. Now, could we have Mairead Collins? You had a question for the two of them. You emailed in. Are you with us?
Yeah, yep, I'm here.
What was your question?
So my question was related to the there, Chris.
Yeah, hi.
Yep. My question, okay, so my question is to the two speakers, the current global campaign for a ceasefire. I just wondered if you had any reflection on that, whether you feel that, if you have heard about it, whether it would be of any significant use to Syria, and also what the issues might be around trying to enforce something like this relating to Syria. Thank you.
Which one of you?
Well, I can try to answer that. I mean, we've noticed that since the spread of the COVID-19, or the official announcement of the COVID-19 in Syria, the bombardments had stopped in most areas. Not stopped, sorry, reduced significantly in most areas in Northwest and Northeast as well, due to the current, I think, state of panic in all of the areas of influence in Syria. We are truly hoping that this kind of reduced hostilities would continue in the future. But honestly, personally, I'm very suspicious that a permanent truth or cessation of hostilities would hold in Syria, given the political reality of the country. I think it's a temporary phase, but it might continue in the near future. Also here, I would like to say that we've been seeing some indicators that there's a growing panic amongst the Syrian army and intelligence forces of a possible spread within the army and these forces, because of the Iranian, because of the as Zaki said, because of this constant interaction with Iranian militias and coming from Iran and Iraq as well. So there's kind of a growing panic. That's why, for instance, in most public hospitals, they're giving priority to army officials and their families. So I think that's also kind of this growing panic amongst the army, and it's also one reason why we're seeing this relative calm. But I'm afraid that it could be temporary, not something long term.
Thank you very much, Zaki. Now we have a question from Alistair Burt, who's joined us. Alistair, you there?
Yeah, I'm here, Chris. Firstly, thank you for the answer on the global ceasefire. I was going to raise that as well. Like all of us, it's an easy one to get behind. It's motherhood and apple pie. Who wouldn't call for a ceasefire at this stage? The question is whether or not, as you say, the realities on the ground, whether it's Libya, whether it's Yemen, whether it's Syria, lead to this. And importantly, whether it leads to any different thinking. It's one thing to deal with the practicalities. It's quite another for people to respond to what was behind the call, which is, if we don't take this opportunity to change our thinking to long-term conflicts, what will? We're simply into the process of these conflicts grinding on until one side or another declares itself a temporary victor for whatever reason. Anyway, you've answered the question, and that's helpful. The other question I had was a practical one. Do you know which health aid agencies are still operating inside Syria that we may be able to support to provide assistance towards, whether it's Médecins Sans Frontières or any other active agency that we can try and get resources to, and those of us with contacts to our own aid agencies can try and pass things on? I'm just interested in who is currently able to operate, or whether the virus has made even the limited work that was going on completely impossible. But thanks to both speakers very much, really appreciated.
Thank you very much, Alistair. Zaki, Mazen, which of you would like to take that?
Yes.
Yeah,
Mazen,
Zaki,
you go
please.
first if you want. Yeah, yes.
Okay, so when it comes to the available medical organizations, well, to be honest, my own personal recommendations is to go directly to Syrian medical NGOs who are currently doing the response plan at the community level. I would suggest, for instance, SAMS, the Syrian American Medical Society, SAMS. They're doing excellent work. I would suggest an organization called OSSM, UOSSM. It's also Syrian organizations working. And also suggest the White Helmets. White Helmets are doing exceptional work. Maybe supporting also there have been a lot of fundraising campaigns for grassroots medical organizations and CSOs in Syria, and I think they are the frontline workers that needs to be supported. In addition, of course, to WHO and to this kind of global organizations. But my personal appeal would be to support Syrian NGOs who are currently on the front line and at the community level.
Thank you very much. Yeah,
I just want to elaborate more on what Mazen said, and actually it's almost proven when we compare between Idlib and the regime-controlled area that when civil society has larger space or has space to act, the results, even in terms of health sector, is much better. So it's very important to support this grassroots and civil society initiatives, not only in the opposition held area, but also in the regime controlled area. I know it's very difficult to open channels with the grassroots and civil society initiatives in these areas, in the regime controlled area, but they're also doing their best to increase awareness and to deal or to confront with the pandemic. And I believe it's a very important opportunity for the external actors to support these initiatives and to increase the space for civil society in the regime-controlled area as a long-term strategy to confront the authoritarianism imposed on them by this regime. Because as we mentioned earlier, that the security agencies in the regime-controlled area are controlling the governance of even the health sector during this pandemic. So it's very important to target or to support civil society initiatives in these areas.
Thank you. Thank you very much. Now we have two questions about the South. Could Bruce Stanley, Bruce, you've got a question about the South.
Yeah, we've looked at the North, so I was just wondering what the situation is close in the South, Daraa and so on, but also perhaps in Yarmouk camp and what's left of the people in Yarmouk camp. Thanks.
And we also have a question from Lynn Arabi as well. Lynn, are you, not sure if I'm pronouncing your name right, but you have
yes, can you hear me?
Yes.
Yes, I was also wondering, just to follow up to Bruce's question about the situation in the South, and particularly about the Rukban refugee camp. Is the WHO and other international organizations still able to access it? And what's the situation overall there? Thank you.
Thank you very much, Bruce and Lynn. Mazen, Zaki, who wants to take the situation in the South?
Yes, actually, due to the conflict and the intensified military operations in the South, the majority of the health infrastructure and the health facilities are destroyed there, and we can see that only 3 ventilators or ICU beds with ventilators are available in Daraa governorate, in all the governorate. And we believe that the situation in the Rukban camp, for example, and in all IDPs camps are not good, and they don't have the facilities and the health conditions or the appropriate conditions to prevent the spread of the virus and to do the treatment. So the situation in the South is let's say it's worse than the situation in Damascus. And as we mentioned earlier, that the situation in Syria differ according to the governorate. And the South, Daraa, for instance, is among the worst areas in Syria in terms of dealing or confronting the pandemic. And this is due to, as I said, to the destruction of health facilities, the lack of medical staff, the large number of IDPs in camps, and the lack of proper infrastructure. And here we're talking about the access to water, because water, for example, is essential to prevent the spread of the virus, and also the lack of economic opportunity or job opportunities, which push people or put pressure on people not to adhere with the social distancing measures. So the situation in Syria in general is bad in terms of confronting the pandemic, but in the conflict zones or the most affected regions is worse.
Thank you very much. Now we've got a question about Turkish armed forces from Batu. Are you with us, Batu?
Yes, I'm here.
Hi.
Hello. Yes, my question was generally about Turkish involvement today. The Turkish armed forces informed through their Twitter account that they'd started to test inhabitants in Turkish influence areas via mobile vehicles. So I just wanted to get the scope on general Turkish involvement with regards to the COVID-19 crisis.
Thank you very much. Very good question. Mazen, Zaki?
Yeah, I'll try to answer that. Yes, it seems that the Turkish authorities have decided to opt out or to test the inhabitants of the Turkish influenced areas. So far, that hasn't been done yet, but it seems it's going to happen in the near future. So, but so far it hasn't done yet, so I don't have enough information on that. Because before they were only testing soldiers coming in and out of Syria, Turkish soldiers coming in and out of Syria, but not civilians. But now it seems they're heading toward also using mobile clinics to do that, but that still didn't happen yet. It could happen very, very soon. when it comes to other measures, Turkey is allowing medical NGOs to also buy the necessary equipment from the Turkish market, such as masks and gloves and hazmat suits and all of that. The humanitarian kind of aid still comes in between Turkey and the Turkish influence areas, but that's only for the northwest. It's not for the northeast. That's areas totally excluded from any kind of Turkish support for the pandemic.
I understand also, Mazen, that the Turkish armed forces have said that they're going to be doing less military activity to cut down on contact, etc. Is that your understanding?
Yes, it seems so far there's generally a reduced military action in most areas in Syria, including also the Turkish involvement. We haven't heard any kind of major military escalation for the past couple of weeks, and it seems it's gonna stay that way from, at least from the Turkish side, for the foreseeable future. So I think we just have to wait and see. Also, these kind of reduced military actions allowed some humanitarian work to be done in Hasaka area, for instance, because they face an issue with the Aluk water supply in Hasaka, which was targeted by the National Army, the Turkish-backed National Army. But now it seems that they're, because of the reduced actions, they were now able to rehabilitate that water supply, which is a very important supply in northeast Syria. So it seems there's some benefits from this kind of reduced military escalation from Turkey, and from Russia. That's what we've been seeing so far. But as I said, I'm personally very suspicious of a long-term reduction of hostilities.
Thank you very much. Now we've got a couple of questions on the WHO. First of all, from Jennifer Larby. Jennifer, are you with us?
Yes, I am. Thank you very much, Zaki and Mazen, for such a thoughtful and thorough presentation of the current situation. I just wanted to know if you could expand a little bit more on the organizational challenges of the WHO and maybe some of the political challenges that you spoke of in both of your presentations. Thank you.
Yeah, thank you very much for the question. Actually, the problem with WHO is that it's very much stick to the protocols of the international organizations working in a state. And they announced several times that they only deal with the government in Syria. And this is a problem by itself, because dealing with the government in Damascus means that they don't, or they are not planning to deal with northwest or northeast. And the other issue that WHO in Damascus, they always work in a very close cooperation with the Ministry of Health, and they cannot conduct any activities without a green light from the Ministry of Health, according to the protocol signed with the government. And unfortunately, the Ministry of Health itself is controlled by security agencies. So we can say that the security agency is controlling indirectly the activities conducted by WHO, as WHO believe that they have to deal only with the government in Syria. We've seen during the last week that WHO is starting to send kits and support to Northwest, and so far they didn't send anything to Northeast, but still the main cooperation is with the government and Ministry of Health, and thus indirectly with dominated by the security, let's say, perspective of the regime in dealing with the current pandemic.
Thank you very much indeed. Now we have Baroness Sheehan also wanted to ask about the WHO. Shaz, are you there? Shaz? Nope.
Okay. Hi, can you hear me now? Sorry.
We can.
I unmuted the video, but not the microphone. So my question is also about the WHO, has already been to a large extent answered. I just want to follow up on that. The WHO is coming under a lot of attack in the press already, and you said that they are now relaxing their dealings with the MOH to the extent that they are now sending equipment to the Northwest. I wonder what has brought that change about, but also there is a danger that the attacks on the WHO, the Chinese situation in Taiwan is very similar to what you're describing, is what's happening in Syria. But they are also being attacked heavily by the UN for whatever reasons. I mean, their own reasons, maybe lack of testing. They want to divert their own shortcomings, I think, onto the WHO. I just wonder to what extent we need to also find ways of defending what the WHO is saying, and that are we in danger of throwing the baby out with the bathwater if they are just subject to attacks from all quarters. The world is in a very difficult position at the moment. Should we be collaborating, or are we going to continue with this competition between nations that isn't really, I don't think, in the long run, going to be very helpful to all of us?
Thank you, Shaz. Which speaker would like to take this?
Yes, I just want to, before I answer, just want to clarify that WHO has been involved in the Northwest since the beginning of the conflict through the health cluster, which is an OCHA health cluster in Turkey, led by the WHO. So it's not the interference is not new. They interfere in the Northwest and Northeast through the health cluster because they have the mandate of the cross-border operations for the UN. So the main issue here that was raised by Idlib Health Directorate and the Health Commission in Northeast is the slow response from the WHO to the current pandemic, and giving a main priority to the government of Syria and asking them to deal with the government in Syria, which is clearly non-responsive to that, and leaving them at the mercy of the Syrian government. For instance, they sent 600 kits out of the requested 2,000 kits. They said 600 kits after like a month and a half of pressure and of lobbying and all of that, so they can accelerate their responsiveness. Of course, we should not. It's not an attack on the WHO itself. It's just we're saying that the WHO should consider having different policies for conflict areas and for conflict-affected areas when you have this political reality such as Syria, Yemen, Iraq, Syria, Yemen, Libya, and all of these conflict-affected areas. When you don't have a central government controlling the rest of areas, you also have local health actors who are quasi-state institutions working in the health sector. So you need to work with them in the same kind of approach during a pandemic, at least the same approach that you're dealing with the government, because otherwise you're going to end up with a long delays that's exactly what's happening right now in Syria, and risking and gambling with the lives of millions. So yes, we want the WHO to continue to collaborate with all areas in Syria, not to politicize this issue of the pandemic, and to treat and to have a comprehensive and equal response to all areas of influence in Syria, to treat them equally and to have the same kind of approach. Because also, as I said, it's not the issue of testing kits, because okay, we're testing people, but most important issue, what happens after we're testing people? the response plan that was put by the WHO plus with the health actors in Northwest Syria has not been implemented yet. And the same thing happened in Northeast Syria. So we're urging the WHO to be more responsive and to have this kind of comprehensive and equal approach to all Syrian or areas of influence in Syria.
Thank you very much. Now we've got a question on sanctions. As you all know, the US and the EU have various forms of sanctions on Syria. Palika, you had a question. Are you there with us?
Yes, I am. Thank you. I was just wondering whether Mazen or Zaki could just be a bit more specific on how the sanctions are preventing the renewal of medical imported medicines. Just some more details on that would be helpful as we seek to address this issue.
Yes. Yeah. Thank you. Thank you very much for this important question about the sanctions. Actually, as we know, the sanctions are not, or there are exemptions, and the health sector is included with these exemptions. So there is no direct sanctions on health equipment and health tools and services to be exported to Syria. But the problem with the sanctions is that the financial sanctions and other types of sanctions are affecting indirectly the ability or the capability of private sector or even the government or other entities in Syria to import medical equipment and medicines to Syria. So we believe that it's important to work more on making these exemptions more practical and to decrease the length of bureaucracy for example, European companies to get approval from the EU to export health equipment and medicines to Syria. But at the same time, we should know that the regime is trying to abuse the pandemic now for its own interest and ask for the lift of all sanctions on Syria. And we should not be confused that between the sanctions on people or individuals or entities involved directly in the violence and the sanctions on health sectors. And as I said, the health sector is included in the exemptions. So there is no sanctions on health sector. But what we need to work on, and the EU and USA should work on, is how to make these exemptions more practical for Syrian people. But at the same time, we should be very aware that the regime should not use the pandemic to advocate for the release of all sanctions on people and entities who are still involving in violence activities.
Thank you very much. Very important topic. Now we have a question from Bernie Howley. Bernie, are you with us? Hello, Bernie? No.
I am.
Yep, hi.
Sorry, it took a few presses on the button to unmute me. I've got a couple of questions, but the main one is that given the current situation and the global situation, which is, it is global, and the existing systems which lead in this situation, which is mainly the WHO, and which, because of the protocols which have been mentioned, is going to fail. Is there any way of bringing all those organizations that already operate, the NGOs within the country, outside the country, bringing them all together under an umbrella temporarily in an unprecedented situation with a newly defined lead of those groups to try and find something that's going to work in zones of conflict? Because this isn't just happening in and around Syria, it's happening elsewhere as well. So it kind of needs a really, really big out of the box approach to try and find a solution that's going to change the system that is stuck That's my question. Is there a possibility that there can be a way of finding a way forward?
Thank you very much, Bernie.
Yes, I think there is an opportunity to do that, even though that's supposed to be the WHO job through the health clusters, the different health clusters in Syria, the OCHA hub in Turkey, Jordan, Iraq, and Lebanon, and the whole of Syria approach. The whole idea of the whole of Syria approach in the health cluster is to have this kind of coordination between different areas. But unfortunately, this is not what's currently happening. You raise a very important point, which is the sharing of information between different areas, which is very key. It's key in this kind of in the pandemic. And unfortunately,
asking about creating a link and how to do it.
So it's unfortunately this is not what's currently happening in Syria right now. There's no sharing of information between different areas, and I truly believe that yes, doctors and medical NGOs in regime-held areas and government and opposition-held areas, they all want to work together. And I think the task force that was established in Northwest could be expanded and could include other Syrian actors such as the SARC, the Syrian Arab Red Crescent, in working in regime areas. It could also include other health actors in order to have this coordination mechanism. And I think there is a willingness and there is an appetite to do that by most of the Syrian health actors I'm talking with. So I'm truly hoping that we could have this coordination body under the WHO umbrella, because they cannot function out that. You need the UN umbrella to do that. But to give the voices to the actual frontline workers, to let them decide on the emergency response plan and how to react and how to share information between these actors. I'm truly hoping that could happen. I think several NGOs are already trying to explore this idea of this collaboration, but we'll see, because unfortunately we had that before and it failed because of all of the political polarization in Syria. So let's hope this time it could be different.
Great, thank you, Zaki. And now we have a question from Wissam Al-Hamwi. How are you, Wissam?
Hi, Chris. Thank you very much. Thanks a lot, Mazen and Zaki. Just wanted to ask you, like within the context you described, and in the absence of top-level policy or coordination, and the kind of the big agencies and organizations' inability to provide a response that can help, what can people and civil society do? What type of activities or initiatives can they engage in that can be helpful? And I'll just put this in the context of other responses in other countries where the response is largely around national level policy that is enforced and supported by the government. So where, for example, a stay-home policy will not work in Syria because people need to go out to work. So what can people do basically to avoid a catastrophe where nobody else is there to help them?
Thank you, Wissam.
Yes, yeah, thank you, Wissam. Actually, the civil society initiatives and organizations can do a lot in all areas in Syria, not only to deal with the direct impact of COVID-19 pandemic, but also to deal with the indirect impact. And here I'm talking about the economic impact. First of all, there are on the ground many initiatives that working on increasing, for example, awareness toward the dangers of this pandemic and how to avoid how to prevent the spread of this virus. But at the same time, there are a lot of civil society initiatives that working on livelihood activities and how to support people in need, especially in this very difficult situation. But at the end of the day, there are two constraints, two types of constraints for this initiative. The first one is the institutional constraint. And here I'm talking mainly about the regime-controlled area. They cannot work freely. They don't have the space to work and to support other people because of the security constraints. And the second type of constraints here I'm talking about is the financial and the resources, the lack of resources. And here the international community can help and can support. And I'm not talking only about the financial resources, but also about technical support. So they can provide and they can open direct channels with these civil society initiatives to support them financially and technically in how to come up with projects to support directly or indirectly people in need, or to prevent or how to overcome the direct or indirect impact of this pandemic in Syria.
Thank you very.
If you allow me, Chris, I want to add also to this question, to Wissam's question. In addition to what Zaki said, livelihood and of course reducing all of the economic pressure, I also think that the civil society, which is it's a big part of the governance of the health sector in Syria, could also work on. We could work together, helping the Syrian civil society to come up with innovative, creative solutions for instance, long distance learning or online learning. Because in Syria now, schools have been shut down, teachers have been asked to go home, and maybe in the government areas, the teachers would continue to get salaries, but that's maybe not the case in most of the areas outside the regime control, because the education is mainly funded by local NGOs through international donors. So this could not, so we could face an issue with teachers, for instance, with the online learning systems. So I think civil society needs kind of also help in finding innovative, creative solutions to cope with these issues. And also, I believe we need also to have a special focus for the gender dimension of the COVID-19, on the COVID-19 impact on women specifically in Syria. And I think we need, civil society need to come up with different kind of protection mechanisms and empowerment mechanisms for women during this pandemic, especially when it comes to the economic pressure of self-isolation or quarantine, or the possibility of increased domestic violence and threats. So I think also when it comes to protection, women protection, and the reduction of gender-based violence, the civil society are the kind of frontliners here, are the ones who could do something to reduce this kind of negative effects of COVID-19 on women in Syria.
Thank you very much. And I think it's a very well made point about the vital role of civil society in Syria. It's something that we at Caabu have always been very keen to promote. I'm going to take a couple more questions, if that's okay with our speakers. I appreciate we've gone slightly over the hour mark, but we have had a lot of questions and people have been very patient. We've got a question from Didier Laura. Didier, are you still there? No. Then we'll.
Yes, can you hear me now?
Yes. Hi, Didier.
Cool. Thanks to take me. Thanks very much for all these debates and great information. I worked recently on how Islamist groups are trying to cope with the virus, and it came to my information, especially a document from the Washington Institute, who said that the rebels in the Idlib pockets actually reacted very quickly in a better way than the Damascus regime itself. So it's not to say, of course, that it would be able to cope with a major outbreak of the pandemic, but can you confirm that? Also the fact that we were talking about WHO, apparently the WHO has worked with authorities in the Idlib pocket. So can you confirm that they've been actually more active, more quickly than the Damascus regime? And if yes, just why? How can we explain that? Thank you.
Thank you very much, Didier. Anybody like to take this issue?
Yes, Mazen, you can go.
No, Zaki, please go ahead. I will, yeah.
Okay. Actually, we almost mentioned this this point. Yeah, that yes, the role that or the reaction of health sector in Idlib to this pandemic was faster actually than the reaction of the government in dealing with this pandemic. And we mentioned that the main reason for that, we believe that it is the space provided for civil society. Civil society organizations in Idlib still have more space to act and to deal with the pandemic or with the emergency in general. And actually, they are trained, unfortunately, in a difficult way. They are trained to do this. So they have the space, they have the capacity, and they have the experience, but they don't have the resources. Unfortunately, the case is not similar in the regime-controlled area. As we mentioned during our discussion, that security agencies in regime-controlled area are still playing a major role in controlling all sectors, including health sectors. So they manage the reaction of health, of the Ministry of Health. They need to make sure that everything is going as planned from a security perspective. And more, there is no space, enough space for civil society organizations and initiatives to act freely in the regime-controlled area. So that's why Idlib act faster than the government in Syria, but we also should take into account the available resources. We believe that Damascus or the government has more resources than Idlib. They already have the health infrastructure, they have hospitals, they have medical staff, and they have the networks. But unfortunately in Idlib, most of the health facilities are destroyed, and they have they suffer from a lack of poor medical, the availability of medical staff due to the continuous military operations. So I hope that this answers your question.
Thank you. I've got two more questions, if that is all right, and we'll try to wrap it up by past. Ahmed Al-Rashid, Ahmed, you wanted to raise a question. Are you with us?
Thank you very much, Chris. Yes. Well, first of all, thank you very much for Mazen and Zaki. My question really is about the southeast of Syria. We know, sorry, the northeast of Syria, and the issue of Al-Hol camp and, you know, the detainees there. I'm referring to, you know, some the ISIS camps there, in terms of, you know, precautions and measures to contain, you know, the spread of the disease. Are there any information about the current situation in this specific context? Thank you very much.
Thank you for your question. Yes, Al-Hol, yes, Mukhayyam Al-Hol. Yeah, actually, we also in our paper we try to also cover that issue, because Al-Hol camp is one of the main issues in northeast Syria. It was originally designed for 10,000 people, but now it's sold beyond 70,000 people. They only have 12 static medical points, mobile clinics, and they only have, I think, they don't have ventilators or intensive care units inside the camp. The camp usually is supervised by SARC, the medical aspects of the medical facilities in the camp is supervised by SARC and by other NGOs in the area. Unfortunately, most of the cases that required previously, most of the cases that required intensive care, they either transferred to Al-Hasaka Public Hospital or to another hospital outside or very remote and very far away from the whole camp. So all of the people we talk to, they feel that the whole camp is a time bomb when it comes to COVID-19. because the spreads in the whole camp, it's not manageable, to be honest. Most of the doctors and experts, they talk if a spread happen in a whole camp, it's not gonna be manageable at all, because they don't have the capacity to do that. So it's one of the main issues in northeast Syria, and of course that adds to the already existing political issues with the ISIS fighters and the family and their families and all of that in this camp. So thank you for your question, because I think the whole camp needs that kind of also a focus, an international focus, because it could be we could have a devastating results if a spread happened in the whole camp.
Indeed. I think at that point, I'm going to have to wind it up very reluctantly, because it was a very rich discussion, albeit I'm afraid not one that is uplifting, and it is going to lift the gloom that we're all, having to live under at the moment. But it was really an excellent couple of presentations. Thank you both, Mazen and Zaki, for that. Thank you also to our partners today, to the LSE, and really to all the questions. I'm very sorry for those who I didn't manage to get in. We had a lot of questions, but I hope that in all of those answers you've got some sort of responses, etc. It just remains me to say that we were hoping, obviously, to arrange new webinars at Caabu. We have one coming up, which we'll be sending the details around very shortly, on the 22nd of April on Libya, another very topical issue, of course. We will certainly be coming back to the issue of Syria. So everybody, please stay safe, and look forward to seeing you online, but even more hopefully in person in the very near future. Thanks so much.
Thank you very much, Chris.
Thank you.
Thank you, Chris. Thank you all.
Thank you.